give some people some tips on who to look for when you start searching for the weight loss contouring. When do you start doing it? When did you start thinking I need to get the skin off? Like, where do I go find these people? Like, who does these kind of things? Like, who how did you point? Can you point people to what to start looking for?
So when I personally started looking for a surgeon, one of the
going through everything you've gone through for now, what would you look for? Like, when people ask you, like, man, Pate, I got all the skin on. Who do I go to? What should I look for? Right?
Well, personally, I'm maybe a little biased, but if anybody comes to me and they're asking me who they should pick, I always say you. But like I said, maybe just a little biased. But typically, I tell people to get as many consultations as you can, and pick who has your best interest at heart. I tell them about what I went through. I tell them typically they should only want to do 6 hours. If they want to do any over that, don't do it. If they don't ask you to get blood work first, don't do it. Those are the type of things that I tell people to look for, because that is, I would say, the things that make it go from terribly good to terribly bad. If you don't know what your blood work is, if they're not telling you about aftercare, if they don't have multiple clients that they can show you that have been through the same thing and have done what you tried to do, I would not recommend it.
Yeah. I'd like to elaborate some of the things that you should, for people who lost a lot of weight and they want to get these big skin contouring surgeries, that there's some risk associated to that. So if they had gastric bypass surgery, that you have some metabolic changes can happen, like nutritional deficiencies that can occur. So, when you've lost a lot of weight with me, I think it's, you're always going to get some blood work. We're going to make sure that you're nutritionally optimized. A lot of people don't realize how deficient they are in protein, and you actually need protein to heal. So the people that are taking all these, these peptides, they don't eat enough protein, and what happens, they become protein deficient, and they have some of these contouring surgeries, they don't have enough protein to heal, and their incisions fall apart, and they wonder why. It's because you don't have no protein in your system. You don't eat protein enough, right?
Yeah, exactly.
And then also the blood counts. Most people don't, some people don't quite appreciate what anemia is, which is the low blood count. And when you do these bigger surgeries, you drop your blood count significantly. As human beings, we have this reserve. It's called our spleen. Our spleen has this reservoir of blood that kind of dumps usually within the 36, 72 hours within surgery, and it kind of gets your blood count up. But these big contouring surgery, we're losing a lot of blood loss. We're talking about like the body lifts or the FTLs. The chest lifts, the full thigh lifts, like those, you're losing a fair amount of blood, and so we want to make sure that the patient is that can tolerate that kind of blood loss. It's so important. Or you're going to have symptoms of passing out.
Yes.
Repeatedly.
Yep.
Some of that passing out right after surgery is associated to just being a little bit more dehydrated than most people think. But we want to optimize, especially in my hands. If you're massive weight loss, we're taking a lot of skin. We're going to be checking your blood count. We're going to be checking all your labs for protein deficiency and all the elements as well to make sure you can tolerate these surgeries. In an outpatient setting, typically our bigger surgeries stay overnight with me.
Exactly.
So it's really just make sure to find surgeons and providers that understand that it's really about safety.
Yes.
Like this is not medically necessary surgery.
Right.
This is not what insurance pays for. Insurance doesn't pay for it.
Not at all.
You're choosing to do this to yourself. You're paying a lot of money to do this to yourself. Please, please, please make the time and investment to find someone that is going to take care of you.
Yeah.
And make sure to get the outcomes that you want, but also, most importantly, safely.
Yeah, because the dollar amount, I understand people say, I want to go over here because the dollar amount is cheaper. When you're doing something like this, think about it. You're going to be wearing this for the rest of your life. Yeah. It's not a car you can buy and trade it in. Say if it takes you a year longer to save the money. I tell people that all the time because they tell me they want to go to Mexico or Colombia or all those things like that. I'm like, you don't live in Mexico or Colombia. Do you realize you're cutting yourself up and then you're going to get on a plane and come back here? Like, have you really thought this through? They're like, well, yeah, people do it. I'm like, yes, but they shouldn't. I like the doctors in Mexico should work on the people in Mexico. If you live in the U.S., hey, I personally believe that's why I did all mine here. And I personally believe, like, I'm not getting on a plane right after having surgery. Like getting on a plane and all those things like that, people don't realize what it actually does to your body. Bodybuilders do.
Yeah.
Yeah, people don't realize they just get on a plane. They think, oh, well, I'm just getting on a plane. Like it actually, messes with your body a little bit when you get on a plane. So I'm not, yeah.
Yeah, I'd like to elaborate on that because, I've talked about this in other videos on YouTube about medical tourism and, the new trend for patients to travel to the DR or Mexico or Colombia for their cosmetic surgery. And the driving force of it really paid is price. Like, it's
Right.
cheaper.
Yep.
Well, let's ask ourselves, why is it cheaper? Why is it cheaper?
Exactly.
Like, this is not me having a personal attack of the Hispanic, the Mexican surgeons. Not at all.
Mm-hmm.
The problem is the price.
Mm-hmm.
The reason they're cheaper is because somehow they're cutting corners.
Yep.
Either it's not in a great facility, or they're using equipment or supplies, or they're not really doing real anesthesia, or the surgeon's not very good because the surgeons can't get a lot of patients other than like for cheap surgery. So that's how they attract patients like that. So, and then you have to figure out like how you're going to recover. Like, do you recover? And what happens if you have an emergency? What if you like lose too much blood and you get transferred to the hospital? What happens then?
Right.
Well, I'll tell you what happens, Pate.
Yeah. Yeah.
They end up shipping you across the border, and you end up in a hospital in the United States because they say, "Oh, your insurance will take care of you."
Right.
And they send you over there, and then you have it happens all the time, man. I'm telling you, all the time.
Yeah.
California, Arizona, the borders towns of Texas. There's plastic surgeons out there all the time that take care of these patients that are just complete disaster. We're talking about like 16-hour marathon surgeries, and they're basically almost dead. And they literally get shipped across an ambulance, almost dead. And they're like, your insurance will take care of it. That's what happens. I'm telling you, this is what happens. It happens all the time. And it's terrifying. And for people to even consider that risk, not going to say it happen all the time. There's some success stories. But is it worth it? Is it really worth losing your life for having permanent strokes or, DVTs from jumping on a plane right after surgery and you have a stroke or you can't move your leg? Is it really worth it to your family and to your quality of life to go through that? For money, just save you more money.
That's what I'm saying. Because I'm like, man, think about it. I mean, just to put it in perspective, think about if I would have went through what I went through across the border.
Man, you'd be dead.
That's what I'm saying. So it's like, yeah, no, to me, it's no brainer. Like I tell everybody, save the money, save your life. Because at the end of the day, like, dude, what is it you're going to save what? A few thousand if that? Yeah, no, it's not worth it. It's really not worth it. Just you've went through the delayed gratification to lose the weight. Just go through the little bit more of delayed gratification to pick a surgeon that's really going to care about you.
Yeah.
And your safety and stuff like that. Because personally, I can tell you, from experience, that anybody that's willing to do 12 hours of surgery on you, like you said, marathon surgeries, is not somebody that really cares about you.